Hey everybody, it's Kevin Anderson, your host for the Ask the Educator podcast. And with me, as usual, Adam Okada. And for this episode, we are following up our monthly international webinar with our guest of honor, our very own Cheron Rojo. If you don't know who this guy is, I don't know what you're doing. So I'm not going to bore you with the introduction on Cheron because pretty soon I think it will be pretty evident that you already know this guy. And so with that, Sharon, this webinar that you just wrapped up is all about inspection and shavers and how to clean them, that kind of thing. Um, you also spoke about this at the HSPA 2025 conference. So, for those of you who
Yes.
were actually there, this might be some review for you, but for the vast majority of you who probably can't make it to the annual conference and expo, I hope you really pay attention to this one. This is huge, some groundbreaking study being done here, if I do say so myself. But with that being said, Sharon, I want to give you a chance to sort of tee up the topic. What makes shavers such an important topic?
Well, the only answer I can give you, Kevin, and everyone listening, is because no one's talking about it. How's that?
Yeah.
Nobody's talking about it. And the study addressed so many issues, inside and outside. That would be my
Yeah.
answer. Nobody's talking about it. And we should be talking about it because it's still an issue.
Yep.
Yeah, I think when we go into facilities and talk to the staff that's working on the floor, they don't realize what a big deal the shavers are and how many outbreaks there have been and how difficult or impossible it can be to clean shavers even with an IFU. So talk about a little about this study that you did in 2023 and 2024. What were some of the results that you found from shaver inspections?
So some of the results, there were actually four areas of results. And what's interesting is I think obviously anybody going to a study, you have questions to ask, right?
Mhm.
And I think we all get surprised, right, Kevin? I know you're currently working on one with shavers. And then
Yep.
when you extract that data, you're like, oh my gosh, I didn't know it was that high. Or I didn't know
Hmm.
maybe it also took you down a rabbit hole that you didn't even know you were going down. But some of the results I can tell you with the proactive approach of shaver leak testing, which is basically a pressure test of the seals, making sure it's holding its pressure. When I use that tool on these, well, in this case, 22 shavers, five of them actually failed that test, and some of them dramatically, where the needle wasn't even fixed, it would just drop. That was 23% fail rate of 22 shavers. And this was across 10 different states. I don't even remember what states I was in, but that's huge.
Yep.
And if I would have doubled that number, I think that number would have grown because a lot of times when it stalls and overheats in the OR, that could be contributed to seal integrity failure where you get fluid invasion because that's why the seals are there. So at least some of those seals are there to help not have that fluid invasion in the electrical components. So that was one of them. The other one that was,
Mhm.
I got to say, really, really high was the borescope inspection. And in this case, it wasn't like doing a borescope inspection and going, "Oh, what's that?" Oh my God, it was so obvious every time what I was looking at. And it was either damage, debris, or both. It was a 92% fail rate for 26 shavers. 24 exhibited some type of debris or damage. And then the microscope for the outside, so using something more enhanced versus just your standard desktop ones, I did 13 shavers, 10 identified with integrity issues. That's 77%. Then
Yep.
lastly, when I used the inspection, not the inspection, but the microscope for the outside, there were some situation like, well, is that debris? Is that protein? Like, what is that? When I used a protein test on 10 of those, eight of them, 8 out of 10 had traces of protein. That was 80%. Yeah, I thought in the borescope inspection, it was going to be like 70. It was like
Yep.
92%.
Yep.
So yeah.
Yeah, really, I I think surprising, yeah, is is one word, but really concerning is another one. And I think this lines up with things that Corey Ofsted has found in her studies. And then
Yeah.
you mentioned mine that, of course, is not published yet, but the data are really condemning of these devices. Unfortunately, they're very challenging to clean. They've been around a very long time. Um, I love that you highlighted the seal integrity test or the shaver leak test because that's something that most people aren't familiar with. And we do leak tests on multiple different devices in sterile processing, including endoscopes and all of that, and people are familiar with that, but not so much with the shavers. And that's a unique uh, thing to bring to the table with some new data. This is the first published data, right, of any leak testing done on shavers, if I'm not mistaken.
As far as I know.
Yeah.
Yeah, as far as I know, yeah.
Yeah, but this is something that, like you said, repair companies or the OEMs are actually familiar with. And maybe with this study, that will help kind of get the word out amongst the industry and sterile processing. Now, one thing maybe failed to mention in the beginning is for those folks who might process shavers all the time, but not really necessarily know what they're used for. This might shed a little bit of light on why they're found to be so dirty. Yours was, I think 92% of them were dirty. All right. That's a
Yeah.
crazy number. In mine, it was 100%. So, uh,
Yeah.
and there are a lot of shavers. So the numbers are pretty astounding. But what they do is they put a disposable tip on this thing. It has a rotational burr or cutter, if you will, and basically it cuts tissue. Soft tissue could be bone, and it sucks it back through the handle and out to an external suction device. And then that valve that you point out in the webinar. There's a lot of good images, you guys. You got to check out the webinar. Shameless plug, I know, but that's where you're going to get a lot of the visuals here. And the valve that turns on or off the suction, that's where a lot of the debris gets hung up, and it's very difficult to clean because you can't lay eyes on it. So now I know you highlighted a lot of different concerns in some major problem areas on shavers. I wanted to give you a chance to highlight that, but just wanted to kind of share what the shaver was used for before we moved into that part. So, Cheron, how about you tell us a little bit more about some of the major problem areas on the shavers?
Well, we don't have a couple hours to talk about that, Kevin.
I know,
So
right?
that's, I don't even know where to start on that one. Major problems, a lot,
Yeah,
a lot. I don't even know how to answer that because it was from the distal to the proximal to the medial. All of it was a problem, major problem. From the lever to the buttons to the inside, the outside, damage, debris. Then I even noted lint. Okay, that
yeah,
was a surprise one. So, yeah, it's a hard one to answer because it's all of it. The whole thing is complex. There's a lot of areas of concern.
yeah.
Really is.
Yeah, I think that might be a better question is where is there not a major problem on a shaver, right? The entire thing can have issues with it.
Zero.
And
Because
yeah,
even the
but
safety cap, Adam, I even noted the safety cap from the
exactly, yeah.
cord, which
Yeah.
I wasn't expected to
Great
like
call
see.
out.
I didn't even think about that.
Hmm.
Yeah.
And I had tons of pictures and issues with it. So yeah, it's zero,
Yeah.
Adam, to answer
And
your
that's
question.
I think that that's something that's good for listeners to know is that if you're looking at a shaver in the outside, it maybe doesn't appear to be very complex, but there's so many internal working components, so many O-rings, so many seals, so many levers and buttons and things inside of the shaver that you don't see on the outside. The outside looks relatively one piece, but there are a lot of things going on
Adam, it's like
inside.
me. On the outside, I don't look complex, but inside, I have a lot of feelings.
A
Okay.
lot of feelings. You feel your feelings, Sharon. Um, we talked a little bit about the seals on the shavers, and I think this is a
Yeah.
really important part of that study that you did because we knew the things about like the lumens and the parts of the shaver that you can kind of visually see, but there's parts that like the seals you don't really see those. Even with a borescope, it's really tough to get up close on those seals. So talk a
Right.
little about the seal. Should we be testing the seals? How do we test those seals? Things like that.
Yeah, so I wish people could just see the webinar because the visuals help with it, like Kevin stated. But really, a seal integrity test is a dry leak test, and we perform that already in SPD for intubation scopes and a variety of, I think, ureteroscopes or cystoscope, a variety of other ones. So it's just a pump gauge tubing, you hook it up, and that's what you're doing essentially with a shaver. So the only other added piece of this is that you would need a stopper to stop or hold the pressure on the very distal end. And there's a variety of, obviously vendors or manufacturers of shavers. So you pick the right stopper. Then you pump it 1 to 2 times, and then do your test. But it's to me right now, it's a proactive approach because when you do have stalling and overheating in the OR during that procedure, it could be, I would say, a high percentage. I wish I'd done a study on that part. Um, could be fluid invasion because anywhere there's a lot of seals, like I showed a really good slide of all the different seals that would affect that fluid invasion going into those electrical components, which if I was to guess, depending on the model, I would say the worst model, one, two, three, four, five seals that would affect that test. And then there was other seals that wouldn't affect the test that affect other things. But it's not noted in the IFU. It's not noted in Amy, which when Amy does end up going there for ST79 to open that document, guess what I'll be adding or trying to suggest to add? ARN does address it and they list the outbreak, which is great. But I got to say that during the manufacturing process of a shaver, they actually do a dry leak test. They're just doing it with an acrylic burr and plugging the hole like you would do with a stopper. And then they're looking to make sure it holds its pressure. But they also do that in repairs. So when they're doing a repair with the shaver, like in regards to the seals, they're doing the same thing. But what's interesting, they don't note it in the IFU for users to do.
Right, and perhaps that's part of the reason for that might just be because there wasn't really a practical way for people to do it for so
Correct.
many years. But now
Correct.
there is, and maybe that stuff will change. Who knows? But you sort of started to touch on some different things. You mentioned a lot of these in your webinar, and we do have a little bit of time about contributing factors. You mentioned IFUs. I remember researching IFUs, and one of them was very specific about brushes, and the other ones were not. One would recommend borescope inspection, and the other did not. Another one that I really thought was an important piece that you brought up was the education side. So like when people typically what happens is you invite the the representative from the company to come and provide education. When it comes to things like shavers and instrumentation, usually those folks are most well equipped to educate the end user, the people using the device in the operating room. But you hit the nail on the head when you were saying they're not really helpful for us in sterile processing. And unfortunately, that's a hard truth, man. And this is one time I will give maybe another company a little bit of props, a little bit of props. I know Intuitive has people set aside specifically to educate the sterile processing. I won't comment on whether they do a great job or any of that stuff or any of that, but I know they have people designated for that, which I think is awesome. But I just wanted to give you a chance to touch on some of those contributing factors, maybe expound on some of those big ones, and maybe if you have any maybe suggestions for how some people could mitigate some of these factors.
So contributing factors, there was a handful, a
Yeah.
handful. One of them, the first one, was they did not have any type of leak test or pressure test, which I already knew that. I knew that going into the study
Yeah.
that no one even, I mean, it was to the point where like, what are you doing? What's that? So I knew already that one to look at failures proactively. The lack of magnification, I wasn't too shocked, but I was a little shocked because I ran into this with the insulation studies that I've done where they just didn't have the right magnification. And as you know, there's different types of levels of magnification out there, and they didn't have the right one to even look on the outside, as well as obviously even having a borescope inside. Or in some cases, they had a borescope, but they didn't think about using it on a shaver. They were so focused on GI scopes because that's kind of what's been out there. We know borescope is GI, but it can be used for other
Hmm.
things. There were no chemical verification tools to identify protein. If you did run across something, you're like, what is that? I don't know what that is. And then, of course, we just talked about education. The
Hmm.
education SPD is receiving is like I said, as an example, is hey, here's 6 or 7 shavers. You can seam sterilize them for 4 minutes. Any questions? And that is it. But what's interesting is that their education of their background for the rep is telling the surgeon how to use it, the scrub tech
Yep.
how to hook it up, and the nurse circulate. So it's really the
Yep.
education's focus on the user of how to use the device, not so much how to clean it. And again, I showed a lot of examples of IFUs that were very detailed of what brushes to use. Here's the product number. Here's the size. Here's the place to get the darn things.
Yep.
And then also the cleaning brushes. The cleaning brushes, again, like I made the comment of like, here's a sponge and a prayer. That's really what they were doing. I mean, they were praying. They had the rosary, Hail Mary, full of grace. Here's your sponge. They did not have the right cleaning brushes inside or outside. And then, of course, the variations in models. There were so many different models and levers that came out, some levers that were there. So it was a handful of stuff. And of course, the IFUs were different based on the model. So that was a lot to
That's
answer
such
your question.
no, it's such a complex issue, right? I mean, it makes sense because they're complex devices. So it's to fix the problem is just as complex as the devices themselves. But do you have any final thoughts for the listeners who maybe are getting some sobering reality, a dose of reality this morning, or whenever you're listening to this on shavers? Any final thoughts for them?
Final thoughts, I would go back to the IFU. Get the IFU, see what it states for inspection, the cleaning brushes and such. And after you get the IFU and you go, I would actually print it out, get a highlighter, I'm old school, highlight all the things that I don't have, and then call the rep in to say, here's your guide. Can you please go over this for our team and do it for all your shifts? And then guess what? Put it on your books to have it annually because you have people leave and they weren't there.
Mhm.
This is just like insulation. It needs to be continuous because
Yep.
we need to have something that is solid, and we're not getting that solid education. So that would be my takeaway.
Excellent. Well, thank you so much, Sharon. Thank you for doing the study. I don't know um, if any others out there are looking into doing studies, but they are a lot of work to collect the data, to do all of that, and then to publish it, and then to share it is a multi-year process. And so I just want to say a quick thank you for doing that and putting the work in and sharing it with
Thank you,
the
Kevin.
industry. It's huge. And that's not lost on me. So huge thanks there. Thanks for coming on the webinar, the podcast, speaking at the expo and sharing all this information. And we look forward to having another podcast with you somewhere down the road after you publish your next study or whatever comes to mind. You're always welcome here on our podcast, Sharon. So
Thank you,
thank
guys.
you. And we'll see everybody or hopefully see everybody on the next one.